Welcome back to the channel. My name is David Osuji, psychiatric mental health nurse practitioner. So last week, a patient asked me something that really caught me off guard because I don't really listen to the news. They said, I heard that the White House came out and admitted that Tylenol causes autism. Is that true? See, I was not aware of this, and that question was alarming to me. And because I don't pay attention to the news, it was also news to me. And since then, I've seen headlines and social media posts that have been spreading this idea, and it has left a lot of people confused and even afraid. And if you're a parent or you're expecting, it is easy to see why this would feel terrifying. So I did some research and I will attempt to answer the question that I was asked. We will take our time and unpack this properly. First, we're going to talk about what autism really is. Secondly, why Tylenol got blamed in the first place. Third, what the best science actually shows, including one of the strongest studies ever done. Four, why autism diagnoses have increased. And five, most importantly, why misinformation can sometimes be more dangerous than the condition itself. So let's get started. What is autism? Think of the human brain as the most complex puzzle in the universe. Billions of neurons, millions of puzzle pieces, all designed to fit together in a way that lets us communicate, learn, and connect with other people. In autism, some of those pieces are shaped differently, hence they fit a little bit differently. The puzzle isn't broken, it is just unique. And that's why autism is called a spectrum. For some people, the differences are very subtle, like needing more structure in their daily life. For other people, the differences are profound, affecting language and social connection. See, because the brain is so complex, there's no single cause for autism. It is not one gene, one chemical, or one pill like Tylenol. It's always the interaction of genetics and environment shaping the brain during development. So, where does Tylenol enter the story? Over the years, researchers have noticed a pattern when they looked at groups of mothers. Those who reported using Tylenol during pregnancy seemed to have a slightly higher chance of having children later diagnosed with autism. That led some people to point the finger, aha, Tylenol must be the cause. But let's pause and play detective for a little bit. Why do people take Tylenol in the first place? For fever, for pain, for infection. So when you see Tylenol in the picture, you're also looking at the culprit, probably a raging fever, a viral infection, some kind of severe pain, some ailment that is causing the person to take the Tylenol. So blaming Tylenol for autism is like blaming the fire extinguisher you find at a house on fire. The extinguisher did not cause the flames, it just was there when the fire broke out, if that makes sense. And this is also where the difference between correlation and causation matters. Just because two things happen together doesn't mean that one caused the other. A simple example might be more people buy ice cream in the summer and more people drown in the summer. But ice cream doesn't cause drowning. The real factor is the weather is hot. So the same principle applies here. Tylenol shows up in the data because sick people use it. But that doesn't mean that Tylenol is the reason that autism develops. One of the most convincing pieces of evidence comes from Sweden. Researchers studied over 2.5 million children, a massive data set. And I have attached the links to this study in the show notes. But instead of just comparing unrelated families, they looked within families, specifically sisters. One sister used Tylenol during pregnancy, the other didn't. Same genes, same family environment. If Tylenol was truly the cause, we should see a difference in autism rates between their children. But when researchers checked, the difference disappeared. That tells us that the earlier link wasn't about Tylenol at all. It was about genetics and family factors that were already present. Here's the part that often gets overlooked. High sustained fevers in pregnancy are known to increase risks in the developing brain. Severe infections can do that as well. That means that the real risk isn't Tylenol, is leaving a fever untreated. In fact, avoiding Tylenol out of fear can be more dangerous than taking it because unrelated or untreated fever is a proven threat to healthy development for a child. Some people point to rising autism rates as evidence that something in our environment, like Tylenol, must be to blame. But here's the reality. There are two big reasons why autism is diagnosed a lot more frequently today. Number one, we are better at recognizing and catching it. 50 years ago, a child who was high functioning on the spectrum might just be labeled as quirky or different. Today, we recognize those differences as part of autism and we provide support for that child. The second reason is that we are saving a lot more sick babies. See, advances in medicine mean that a premature and a very sick infant survives at a much higher rate. So these babies, because of their early complications, are also at higher risk for developmental differences, including autism. See, their survival is a medical success story, not a failure, but it does increase their risk for autism. Now, this is where misinformation does some real harm. When a headline screams, Tylenol causes autism, parents get scared. Some avoid Tylenol when they need it most, putting themselves and their babies at risk. Others carry unnecessary guilt, right? Parents of children with autism already face enough challenges. They don't need to live with the fear that a safe medication somehow caused their child's diagnosis. And beyond the personal level, misinformation erodes trust in science and medicine, making it harder for people to know what's real and what's not. So let's take a step back. What do we actually know about autism? It is primarily genetic. Risk can be influenced by rare genetic mutations, advanced parental age, or extreme premature birth. It is not caused by vaccines. That has been debunked. By Tylenol, by parenting styles, or by something you ate during pregnancy. The science is clear on this. So here's the bottom line. Tylenol does not cause autism. The apparent link disappears when you account for genetic factors and family factors. The real danger comes from untreated fever and from misinformation that spreads fear and guilt. If you're pregnant and unwell, talk to your doctor. Tylenol is safe when used as directed, and it can protect both you and your baby from the real risk of fever and infection. And if you've already used Tylenol in pregnancy, please know this. You don't need to carry any guilt with you. You made a safe and reasonable choice. So, if this talk has helped clear things up, share with someone who might be worried or might benefit from it. And let me know in the comments. And if there are any other health related headlines you may have seen recently that left you wondering, is that true? I'll be glad to unpack that in a future video as well. So just let me know. If you want more evidence-based talks on mental health, medications, and wellness, don't forget to subscribe to the channel and share with someone else who you think will benefit from it. Thank you for watching. And remember, good decisions come from good evidence, not from fear. See you in the next video.